Hi guys, welcome back. In this video, we're going to be going over the Student Medication Authorization and Care Plan book. This is a very important binder. You should already have this binder in your clinic, okay? What it's going to have in here, or what it should have in here, is the first thing is your policy, okay? Your medication administration policy. This is a school board policy. You can find this on the Coordinated Student Health Services website. For this year, 2018, it has not been updated yet, so just keep an eye out for that new policy. If you cannot find it on the website, just ask your supervisor, and your supervisor will provide you with the current policy. Okay, the second thing that you need to be focusing on is your tabs. Okay, please do not write the student names, okay, in alphabetical order. That's incorrect. We don't want to have HIPAA going on where you're, putting student names out there for everyone to see. You need to just have alphabetical tabs. They have these available already done. You can ask your office manager. Some of the schools already have them. If you do not, don't worry about it. Just get blank tabs from your office manager, okay? And just create them just like I did, okay? All the student orders are going to be in this binder, or the medication authorization forms. That's what the school board calls the orders, okay? They need to be placed in this binder by last name, okay? So let's look at our example. This is just an example order. It's not an actual order. This is student Casey, okay? So what you need to focus on is everything on the sheet, okay? Make sure that everything on the sheet is filled out, and everything in this order has to be a complete order, okay? So allergies, diagnosis. So in this case, allergies is peanuts and milk. Diagnosis is asthma and severe allergies. So that's 2 diagnoses, okay? EpiPen was prescribed 0.15 milligrams IM. PRN is a frequency. Specific times is when a severe allergic reaction occurs. And then special instructions or side effects is call 911 if administered. Please make sure it's a complete order, okay? It's there for you. Medication, dosage and route, frequency, specific time, so on and so forth, okay? Let's go to the next one. Albuterol, 0.083%, 1 vial, okay? PRN, what are we missing here? The route, okay? It should say be a nebulizer, okay? 4 to 6 hours for wheezing. It needs to be specific. You can't just say albuterol PRN, okay? That's not good enough. We need to know when, why, how, okay? So for wheezing. And the next area you need to be focusing on is your signature. Anybody can write this order, so please make sure it is signed. Some of the clinics or the pediatric associates, what they like to do is they like to stamp, okay? Make sure the stamp is okay, but it needs to be signed by a doctor. The next important thing is your date completed, okay? Please do not receive, okay, an order or a med authorization sheet that the date is not on there. Why? This order expires a year from this date. When you receive this order, what you're going to do is you're going to write the expiration date up top. Very, very, very important. In red only, okay, on the top right-hand corner, okay? This is going to alert you and let you, it's a reminder, okay, when this order expires. If you see it's 8/22/17, so the expiration date would be 8/18. Why didn't I put 8/22/18? Because if I put 8/22/18, I'm going to wait until the 22nd to tell this parent that this order needs to be renewed. Okay, that's not giving time to the parent. So please be courteous. If you just put 8/18, it's going to tell you, okay, on the 1st of the month, I'm going to call this parent and I'm going to say, hi mommy, just letting you know this order is expired. We do need a new order. Okay, that's giving her 22 days to go and get this done. Okay, if the order is expired, I cannot administer this medication. Why? Because we follow doctor's orders. Okay, all right. So the third part on this form is parental permission for medication. Okay, this is giving you and the two authorized individuals in the staff, okay, to give medication, to administer medication. We'll talk about the two other people in a later video. Okay, that's going to be in the communication binder video. Okay, on the back, okay, you are going to have suctioning, trach, care, cleaning, NG tube. If this does not pertain to you and you do not have a student that has any of these, most of the clinics don't, okay? What I like to do is I like to cross this back part of the order off when I'm giving them a blank authorization form to go get filled out by the doctor. Why? It's redundant. Why? It has already the order section here so they can write their orders here, okay? And it has a parental permission, which in the front it also has a parental permission. So unless, okay, this needs to be filled out, just cross it out, give them the blank med authorization sheet to mommy so she could get it filled out, and they don't have to fill out both sides. It's a lot of stuff to fill out, okay? In this case, it's not wrong, but they rewrote the order. Okay, why? Because here it does say nebulizer. Okay, so why do I have this in a clear sheet? If you notice the other papers for the student, okay, I call it the packet for the student, okay, this is the only paper that is in a clear sheet. The reason why is because it's easier to flip to the next student, okay, if it's in a clear sheet. So if I have 3 students under the letter C, okay, then that means I have 3 clear sheets, okay, and I could just flip to the next student easily. I don't have to keep flipping through each sheet, if that makes any sense, okay. Another reason is because a lot of these orders do get updated and we do not throw any orders away. So what I like to do is I like to hide the old order and then place the new one to be visible. So there will be no confusion as to what order to use. Okay, like for instance, if a dosage was changed, okay, both orders, okay, the new order that mommy gives me and then this order that I already had, okay, they're both going to be non-expired, meaning they're good orders, I can use them, okay, but one is the most current. So I'm just going to hide this one and just place the new one in front, okay, so I don't get confused or the cover nurse won't get confused as to what order to use. The next sheet here that's part of the packet, okay, notice it's not in a clear sheet, is your assessment. So if you're an RN or an LPN, you are going to assess regardless, okay? The only difference is that the RNs are going to print and sign, okay, at the bottom of each form. If you are an LPN, you're still going to complete this. It's okay to complete, but you will not sign, okay? When your supervisor comes once a week, okay, you're going to let her know that she's going to ask you, do you have any care plans that need to be signed? And she's going to review them, and if they're okay, she's going to sign, okay, for you because she's an RN. Okay, so let's go over this form. It's very, very straightforward. You're going to fill out the top with the student's information, and then here on the right hand side it's going to ask you what the diagnosis is. So in this case, remember student Casey had 2 diagnoses, severe allergies and asthma. So I'm just going to check off what applies. If you do not see the diagnosis on the list, you'll check other and then you'll write what the diagnosis is here. On the right, you're just going to check off what applies. So, special orders for care from a healthcare provider. I do have special orders, so I'm going to check that off. Medication and authorization. I have the medication in my hand that mommy brought in, okay, the EpiPen and the albuterol, okay, and I do have authorization, okay. Special training of school personnel, okay. All staff members that have students in their class with a health condition, they need to be trained, and they will be trained by your RN supervisor, okay. So yes, I'm going to check that off because we need that staff to be trained. Special diet. This student is on a special diet technically because he's allergic to milk and peanuts. Added safety measures. Okay, yes, I am adding safety measures in this case because in the classroom, the teacher decided to send letters to the parents saying that it's a peanut-free class. Okay, so that's a change in environment and it's an added safety measure. So I have both checked off. Measures to relieve pain. In this case, the student has severe allergies and asthma, so there's nothing to relieve pain. So I'm just going to not check that off. Self-care assistance. Student does not self-carry and does not do this by themselves, so I am not checking that off. This brings another point. If the student is going to self-carry an inhaler that is allowed, okay, the order or the med authorization, okay, needs to say self-carry by the doctor, okay? If you speak with mommy and there's something specific that you want to address or let anybody know that reads the assessment, you can write it here on the comment line. On the bottom here, if you notice, it says student needs individual health care plan only, or student needs individual health care plan and emergency health care plan. That's what that IHP and ECP means, okay? In this case, I need to know what to do on a daily basis with this student for asthma and severe allergies, and I need to know what to do in case of an emergency. So we need an individual care plan and we need an emergency care plan. So in this case, I checked off that the student needs an IHP and an ECP because he needs both, okay? Betty Nurse, she signed and then she printed. Please make sure you are printing and signing on any paper. We want to know who you are, and we don't know who you are just by a signature. Okay? All right, so that's the second sheet that's going to be in every, after every med authorization form. The next one is going to be your individual care plan. Okay? Thank God we do not need to create these care plans. They are already there for us. So look at your master binder and see what care plans you need or that you don't have, so you can let your supervisor know, and your supervisor will supply you with the ones that you don't have. Okay? They are by diagnosis. So remember, we have two diagnoses. We have severe allergies and asthma. So we need to make sure we have an individual care plan for asthma, an emergency care plan for asthma, an individual care plan for severe allergies, and an emergency care plan for allergies. So this is our first diagnosis, is asthma. So all we need to do is check off what applies. Please read these. Don't check off everything. The supervisors are very good at this. They look at all of the sheets, and if they realize that everything is checked off, it kind of looks suspicious and it looks like you don't know exactly what you're doing. In this case, anxiety related to disease process was not checked off, which means the student is not experiencing any anxiety, okay? So that's why it's not checked off. Then on the second part over here, you have classroom teacher, okay? Homeroom teacher should be the one that you choose to put on here, the name of the homeroom teacher. Like for instance, for middle school and high school, they have multiple teachers. If you can get all the names on there, great. If not, focus on your homeroom teacher. They need to be placed on that line. Special area teacher. I like to put the PE teacher, especially for asthmatics. Okay, we need to educate that, that PE teacher in case of an emergency happens. They can also prevent, the student from becoming getting into an emergency situation. Okay, the next one is administration. Okay, so you can put the office manager, okay, or the principal or whoever in administration that you prefer. We like to put the office manager because that's the one that you're going to know and communicate with the most. The last one is support staff. Okay, that's your front desk clerk. Okay, here in this one they put front desk clerk, but really it's that two staff members, any of the two staff members, or you could put both, that are certified to administer medication. Okay, then over here it says reviewed with parent in person, okay, or by phone. And in the beginning of the year, you're probably going to communicate with most parents in person because they're going to bring you that medication, okay? Or you could be communicating with them both by person or by phone, so you're checking off both, okay? The next line, okay, is going to say unable to contact parent after 2 attempts. That really doesn't get checked off. You should be able to contact the parent. Emergency care plan completed. If you completed the emergency care plan, you're going to check that off. And then again, RN signature. So you're going to make sure that the RN signs and prints their name if you are an LPN. If not, if you're an RN, just print and sign. The next one, remember we said we need to know what to do in case of an emergency. So this is the emergency care plan. These are great. It tells you what to do. It tells you the sign and symptoms. Okay, this is really geared to healthcare professionals. So your teachers, when you complete this, need to have a copy of this. What I like to do is I like to make copies of these emergency care plans. I like to place it in their the teachers' mailboxes right away, and I write little sticky notes on them and say, from your clinic nurse. I put my extension. Please call me if you have any questions. This is one of your students. Okay. So, and then if they need to be trained and they haven't been trained, I usually put please call me so we can set up a date for training. Okay. So on your right, it'll tell you your asthma triggers, exercise, pollen, etc. Over here, it's going to tell you the symptoms, and you just check off what applies. How do you know this information? Because every student is different. So what I like to do is I like to highlight, okay, what I'm going to be asking the parent, and then I just give them a call. It's just faster for me, faster for the parent because they may be at work. I usually call them and say, hi mommy, do you have 5 minutes? I would like to ask you some questions, and then I just read off of what I highlighted, and it goes a lot smoother. Okay, you also just sign here at the bottom. Okay, remember 2 diagnoses. So that's our individual care plan for asthma and emergency care plan for asthma. Now we have the individual health care plan for anaphylaxis/allergy, and then the same thing, emergency care plan. Now your last sheet after your individual health care plan and your emergency care plan is going to be your student medication log. And then we're going to go over this log now, and I'm going to take another one so you guys can see a little bit closer and I can go through everything. Okay, before we go through this, I want to make a point. Let's say if you have a student who has sickle cell anemia, okay? Sickle cell anemia, you're going to need, okay, your doctor's order, you're going to need your assessment, you're going to need your individual care plan, and we need an emergency care plan, okay? But what if you have a student who has ADHD? Think about that. You're going to need an order, your assessment, individual care plan. Do we need an emergency care plan? We really don't need an emergency care plan. That's more behavioral. There's nothing to do in an emergency situation for ADHD. So just keep in mind, keep your critical thinking skills. If you're not sure if that student needs or that diagnosis needs an emergency care plan, just give your supervisor a call. You could always call us and ask us here at the office, and we'll be more than happy to answer your question or send you the care plan if you don't have it. Okay, so let's go over the last sheet that should be after the emergency care plan. Okay, this is called your student medication log, okay, or your MAR, okay, what nurses know as a MAR. If you look closely, okay, this top part is the student's information. Yes, it's redundant, but it needs to be filled out completely. If you don't know the side effects, please don't put something there if you don't know it. Make sure you are looking up the side effects. If not, again, ask your supervisor. She can answer those questions. Right here, focus on the month and the year. These are only good for 1 month, okay? So I should not be seeing multiple dates on here, meaning I gave the medication in January, so I'm going to log January. I gave the medication in February, so I'm going to log a February date, so on and so forth. No, this is only good for 1 month. So in this case, this MAR was created in August of 2018, meaning it's good for August only. Okay? So another thing you need to focus on is right here. This is your guide, your key, your cheat sheet. It's very simple. It tells you name, dosage, time to be given, and route. Okay? Let's go over it. Now, student Casey had an EpiPen and albuterol. So the name of the medication is EpiPen. 0.15 milligrams is the dosage. Time to be given is PRN. Okay? And route is IM. You can use these little boxes and put multiple medications on there. If you notice, I have my EpiPen that mommy gave me, and I have the albuterol on here, so they can share it, okay? Now, you'll see numbers here going across, 1, 2, 3, 6. What I do when I fill this out is I take my current calendar, okay, and I go to August. So let's look at August. If you notice, it says 1, 2, 3, okay, 6, 7, 8, 9, 10, so on and so forth. It does not have weekends. If you decide to put 1, 2, 3, 4, 5, 6, 7, you are not going to have enough space for every day of the month. So please use your calendar. If you see that there are dates that are kind of shaded in, okay, there's a key on your calendar here, okay? So from date 8 through the 14th, the school is closed. So there are codes right here that you need to be using, okay? V is for vacation or school closed. So from the 8th through the 14th, I put V's because I will not be administering that medication, okay? Now, let's say I call on the 15th, okay? And I call the teacher because the student my student has ADHD, and that student did not come at 8 a.m. for his daily medication dose. I call the teacher and the teacher says, oh, that student's absent, okay? Okay, thank you. I'm gonna look at the codes here, okay? The code is A for absent. So I'm gonna put A instead of V, okay? That means that I did not give that medication on that date because the student was absent. What if I gave out, and here, if you notice, I gave albuterol, I gave it on the 17th, okay? So all I'm gonna do is I'm gonna put the time that I gave it, I'm gonna initial. Are initials sufficient? No, we don't know who you are by your initials. So I need you to print your name and sign just like I did here, okay? You have 4 signatures. There are 4 weeks in a month, okay? So for every week that I gave that medication, I'm gonna sign, okay? Only once, okay? So let's say I gave albuterol every single day for that week. I'm only gonna have 1 signature. Let's say somebody else covers me the second week and they give it only 3 times, okay, that week. So that's week 2 of that month. She's gonna sign and print here, okay? Let's focus on the back of the sheet. Okay, this is not 2 separate sheets, okay? I see a lot of nurses printing this out as 2 separate sheets. Please don't do this. The documentation gets lost after time in that binder. When you're flipping and flipping, it can come off, okay? So please make sure that if you don't know how to print double-sided, you're asking someone in the office, hey, can you help me and print this 2-sided, okay? So let's focus on what this area. This is documentation, okay? It says on 8/17/18 at 11:05, okay, student came in complaining of shortness of breath. I have my vital signs, albuterol. Now with the vital signs, okay, let's do focused vital signs, okay? In this case, asthma is the condition, right? Okay, so what are the vital signs that I'm going to be focusing on? I'm going to be focusing on respirations and heart rate. Okay, make sure we all have stethoscopes on us. Okay, we need to be auscultating before the treatment and after the treatment. Okay, because we need to document and we need to assess. Okay, albuterol was administered via nebulizer as per doctor's order, okay, or med off. Wheezing was heard upon auscultation. Will reassess student in 15 minutes. 15 minutes is the golden rule to assess. Of course, you're going to be watching and monitoring the student the whole time, okay? But if you want to see it before and after, if you want to see compare from before he received the treatment to after, you got to give a little time for that medication to work. So 15 minutes really is the goal. Okay, so please document every 15 minutes when a student is symptomatic, meaning he's not feeling good, and you had to give him some type of medication. Okay, so at 11:30, I documented student stayed in clinic after nebulizer treatment for 15 minutes. Student stated he felt better, no wheezing heard post-treatment, lungs were clear bilaterally, student returned to class, and parent was notified. Okay, you need to write what you did, okay, how the student is feeling, okay, did you contact the parent? It's very, very important to do this. So if you need to document, please document on the back of the sheet. Okay, on the bottom here, you're going to check in your medications, okay? So this was created in August. Okay, this was created in August. Okay, mommy came in. She gave you that med authorization form. You got your assessment ready, your individual care plan, your emergency care plan. Now you're going to get a blank MAR. And you're going to say, please, mommy, don't leave. Okay, and you're going to say, let me have you sign here and check in the medication. This is where you check in the medication. Okay. It puts the date on there. EpiPen 0.15 milligrams. Okay, it tells you what to do, name and dosage. Amount, which means if you look over here, it's the number of tablets or amount of liquid. Okay, so in this case, it's an EpiPen. EpiPens usually come in two. Okay, mommy can keep one in her purse and give you one to keep in the clinic. That's okay. But please keep in mind, you need to document how many pens mommy gave you. So here I wrote, mommy gave me one box, okay, because it needs to have the pharmacy label on it, okay, and one pen, okay. That way, at the end of the year, if mommy forgets and asks you at the end of the year, where's the other pen, you can say, no, mommy, you didn't give me two pens. You only gave me one, and you have the documentation to prove that, okay. Over here, she's going to sign, okay? And then over here, LPN or RN or whoever received the medication, hopefully it's you, the clinic nurse, and not front office staff member, okay? You're going to sign right here, okay? So you need to have signatures for every medication that was brought in. Very, very important. Okay, so that's your MAR, okay? That is the last sheet, okay, that you're going to have for each student. Okay, so if you want to review really quickly, you have your order in the clear, you have your assessment, you have your individual care plan, okay, you have your emergency care plan, and then you have your MAR. Okay, now we're ready for the next student. Okay, so you're going to have all of your students like this in alphabetical order, and each student is going to have that in there. If you have a medication in your medication cabinet, you need to have an order for it in here. Let's say, for instance, you have a student that has sickle cell anemia, and that student does not have any medications in the clinic. Okay, we still need to account for that student. We still need to know that that student has a healthcare condition and what to do in case of an emergency. Okay, so in the back, after the tab Z, okay, the last letter of the alphabet, you should have a care plans only tab. That care plans only tab, you're going to keep care plans here for students, okay, who only need care plans and do not have med authorization forms, and we do not have any medications for them. That way, in this binder, we can differentiate between the people who have medications and the people who have health conditions that don't have medications. Okay? Now I want to talk about how you're going to receive the medications, what you need to look for, and how you're going to organize it in your medication cabinet. In the clinics, you're going to have usually small medication cabinets that are placed on the wall. They have a lock and key. Okay? Some of these clinics or schools are older, so there wasn't that many students back then, but now there's a lot of students. So please do not shove, let's say you have 50 meds and you only have a med cabinet that's about this small. Please don't shove medications in there. That is not safe, especially for a cover nurse to not know where that medication is. It's very frustrating, and things can get lost or damaged. Okay, if you run into that situation, you will have big cabinets. Okay, make the clinic your own. Clean out that cabinet space and make it your medication cabinet. On the outside, you need to label it medication cabinet. Okay, so everybody who goes in there to administer medication, they know where that medication is located. Okay, you need to have Ziploc bags. Okay, you can have gallon size bags and quart size bags. Okay, for the smaller medications. Maybe that's the student doesn't have that many medications. Okay, what we like to do is we like to keep all of the supplies that student has, or multiple medications in that Ziploc bag. So you're going to take a blank Ziploc bag, you're going to put the student's name on it by last name, okay, then their first name, okay, and you're going to put everything, okay, in there. You're going to put all your supplies. So for this student, he or Anais is a diabetic student, but she's also allergic to peanuts, so she has an EpiPen. So if you notice, I have all of my diabetic supplies in here. Okay, I have my glucagon, I have my ketone strips, I have my Accu-Chek. Okay, I even have some gloves in there. Okay, and I have my EpiPen. And let's talk about this. This is an EpiPen. Okay, does it have a box? It does not have a box. It does not have a pharmacy label on it. Please do not accept medication that does not have a pharmacy label on it, okay? Very important. Let's say it's the beginning of the year and mommy brings you that medication, okay, like this. Okay, oh, here's his EpiPen and she has the order. That's great. And you ask her, mommy, I can't receive this. Where is the pharmacy label? And she tells you, oh, I accidentally threw out the box. Okay, what you can do is you can say, okay, mommy, I'm so sorry, but I can't accept it. But what you can do is you can go to the pharmacy, tell them that you recently were there, you threw out the box, and the school needs the pharmacy label. More than likely, they will print out the same pharmacy label and put it on the EpiPen. Now they'll bring this EpiPen with the pharmacy label on it. Now they know for going forward, and you can receive it with the pharmacy label. Okay, so you're going to place all your supplies in here. Okay, just like this. All right. Now, if you notice, I have a med authorization in here. Okay, you are going to make a copy of your medication authorization form, okay, aka your doctor's order, okay, and you're going to fold it like this, okay, and you're going to place it in your baggie. Why? The reason why is in case of an emergency, we're going to look for that student, grab the baggie, and go to the student. We're not looking for binders or orders. We are running and going. It saves time and it keeps everything a little bit more organized. Okay, let me show you what the box looks like. Okay, so this is an actual EpiPen box. It has an expiration date on the box. Okay, when you receive the medication, you want to make sure that you are looking at it, okay, making sure it's never been given, okay, and you're looking at the expiration date on here and you're matching that expiration date with the box. You don't want any medication being put in here That's not the actual prescription, okay? So please remember to compare those expiration dates and make sure that the medication matches what was prescribed, okay? Okay. Now, if you're receiving over-the-counter medication, you want to make sure that it is sealed. Every over-the-counter medication that comes in a bottle, comes in a box, and it is sealed. Okay, when we receive this, we want to make sure we are putting the student's name on it in black permanent marker. That way, if Sally has the same medication as Johnny, we're not sharing medications. Okay? And that's it for medication administration binder.